the Cross River State Commissioner for Health, Dr. Betta Edu, via Skype. Thank you for joining us on the program. I'd like to begin by asking if you could talk to us about the fears of the Cross River State government with where it is located and the border area, especially as we are tackling the coronavirus pandemic and how that is driving the sensitization.
Thank you very much, and it's nice to be on with you. I think the COVID-19 pandemic has come to strengthen a lot of the different areas in the health sector, and one of it is the risk communication area. We've been doing a lot of work because of the location of the state. Remember that the state has very, very wide border with Cameroon, and Cameroon has a high number of cases, confirmed cases of COVID-19. For us in Cross River State, we've identified border areas, we've identified hotspots where we visit from time to time to talk to them about COVID-19 and see how we can provide PPEs for health workers walking around those areas, increase surveillance, get in more natives, that's the locals, to be part of the surveillance team, improve the skills and capacity of course, the rapid response team to be able to respond in time when they have suspected cases of COVID-19. And what's most important is the fact that the state has also been able to set up sample collection centers, one in each local government, and then of course sample collection centers in these hotspot areas. One of it was the refugee camp in Ogoja, which is where we house over 36,000 Cameroon refugees in Nigeria. And of course, you know, the borders are not so tight, so from time to time we might have one or two persons coming in from Cameroon into our state, and we're continuing to work with the immigration service and several other key stakeholders to see that we don't have people come through. However, those who are in, we'll continue to sensitize them, we'll continue to bring them into the fold to ensure that they are part of the surveillance team that can be able to report when we have suspected cases. Beyond that, we've made available face masks, hand sanitizers, and several other palliatives to support the Cameroonian refugees.
Well, just like some of the visuals we're sharing right now, we're seeing a lot of awareness and sensitization. We also notice there's also a crowd. So in line with the safety protocols, especially with physical distancing, how are you trying to perhaps raise that awareness? Another thing also is testing, regular testing. Is that taking place?
Yes, we have a lot of testing taking place. Really, sensitization is key for us because it would help people come forward voluntarily to get tested. And of course, sensitization is going on, testing is going on, and number of tests done in the state has really increased over time. It's over 100% increase. However, the rate of positivity has remained very low. For instance, in a border community in Boki, that's the Budwe border community, we had over 150 samples taken, and we had just one case positive, and that case was said to have just returned from where we traveled to. So we're seeing a situation where we are doubling on the number of samples we're taking and the number of tests that's being done. However, the positivity rate is quite low.
All right, we appreciate your time. Wish you all the best as you continue with the awareness there in Cross River State. We've been talking to the Cross River State Commissioner for Health, Dr. Betta Edu. Thank you for joining us.